Welcome, everybody.
Live, and Joseph's going to get up on the chair. We're live, and Joseph's getting up. He's Hi.
At least we can see Joseph's face. Pamela,
I know we can see him. Yeah. I can't back up anymore because our treatment here. So, okay. You started?
Okay, so we have Pamela, as everybody knows, Pamela Giustizia, and from Muse MediSpa. We have Veronica from Muse MediSpa, and Pamela's going to talk a little bit about Veronica. She's our surprise guest. And we have Joseph back by popular demand.
His videos so far it's gone like viral a little bit.
I wanted to do pigtails today, but I noticed you did slick your hair back the next day, which was great. It looked great on you.
I always keep my promises.
And you were like totally
great.
Yeah, and you look like you were like really feeling good. So as Dr. Gill said, I am Pamela Giustizia. Joseph and I are the owners on Muse MediSpa here. We just got the okay to open as Friday night, Monday being the first day to open. So today is our first day with the MediSpa, kind of with the staff. The hair salon is open. But we have a few different protocols that have to go in place on the medical side of things. So Thursday will be our first day taking appointments. And I wanted to introduce Veronica. I'm going to let her speak a little bit, but I'm super excited. She comes highly recommended, master injector, nurse practitioner, and been in business injecting, making people beautiful for
a long time.
You don't want to say. See, Joseph never wants to say how long he's been doing stuff too.
I think that's called ...
Yeah, ... So can you tell us a little bit about your? Yeah.
I've been in the nursing field for, let's say, 28 years. 11 years ago, I became a nurse practitioner, and I was already in the aesthetic profession at that time, and went on my own as a nurse practitioner doing injectables and chemical peels and weight loss and lasers, and decided to join Muse MediSpa here and join the team, and I'm very happy that I did.
And also integrative medicine, which I'm super excited about, just like with the hormones and things like that. So very excited about that. But today is it's Transformational Tuesdays, right? Can I share that yesterday was my birthday?
What happened?
So yesterday I turned 51, and I woke up in a cranky mood, right, honey? I was cranky. I was like, this is a birthday that's going down in history because I'm like working all day. I worked all day on Mother's Day, and I was in kind of a bad mood. And then my husband surprised me. Go ahead.
I think I talked with you like early afternoon, and you hadn't eaten anything the whole day.
Yeah. I hadn't eaten anything, and I still, even today, I'm like I haven't even had a chance to eat because there's just so much to do to make sure we have all of the protocols in place, that we're protecting our patients and getting all the staff on board, and just, getting all the emails and all that out there, and still doing these webinars every day. So Joseph surprised me. I literally was still getting some work done, and he's like, well, I'm going to go make dinner. I think I'm going to make like a meatloaf or something. And I'm like, meatloaf? It's my birthday and we're having meatloaf? Okay. So I come downstairs, and he got the best huge king crab legs. Like, they were the best, like meatiest king crab legs, and a nice bottle of what kind of champagne?
Good champagne, I don't know.
Really good, really good champagne, which I don't normally drink. Yeah, Wave or something, and made a beautiful salad, and we listened to great music, and I just sat there for a minute, and I was like, you know what? I've been thinking about this the wrong way, the whole 51 thing. I'm like, 51 in life has just begun. What the heck am I thinking? So that's my,
yeah, it takes time to find somebody as fabulous as Joseph and build that relationship that you two have between each other, and to.
Although the last 2 months being at home all day together. But we've had fun.
It's 51 years well spent to get to where you are, and now there's so much more adventure and excitement ahead. So it's
yes, and so I'm super excited about what's coming our way this year, and super excited that we're able to be back in business and we can do what we do best. It's beauty, everything beauty and health and wellness for our clients, and really excited about that.
Yeah, and so today we were wanting to keep it really light and fun. So today's Transformational Tuesdays, we're going to talk about glam and what we can do to party it up. And have you noticed the length of Pamela's hair? It has transformed.
Man, you should see the vitamins I'm taking. Let's call it glam Pam. No, this is like, we don't even sell these. This is just like this ponytail. Because I wasn't on the next day when you did the whole wax and back, so I was like, I'm putting this in my hair today and I'll be the genie.
It's really pretty.
Anyway, do we want to talk about, we're going to talk about a couple of things that we can do that will be like instant, make you look and feel better now that we are able to get back out in the community, or at least a lot of the places are able to get back out in the community. And I know we are having to be very careful with how we're scheduling, so we're not able to get as many people in the salon and the med spa, because you can't have people right on top of each other, you know. So, you know, I wanted to just kind of chat about a couple of procedures that we do that no downtime and can automatically just really give you a great glow. And I think Joseph wanted to share a little bit about
I want to actually bring you up to date a little bit on how people lately, I mean, you know, this is our first day back, so it's been a lot of fun, you know, hearing people's, you know, reaction to the time off, and they're really grateful to be back. And
we all are wearing masks when we're out.
Yeah, we're doing everything we're supposed to do, and people are really grateful. But I will say that quite a bit of the people have watched what you guys have been doing, and finding actually some knowledge that they're getting out of it, and they're feeling good. They've all told me, so it was really kind of cool. And I said, well, keep an eye on us today.
You know, I've been massaging my scalp every night.
I've been hanging my head over the side of the bed, like he said, and he's like, what are you looking for? And I'm like, I'm getting circulation to my scalp, like you said. So, do you want to talk about some hair stuff first, or you want me to talk about the Aqua-Gold? Okay, this is one of my, I am addicted to this treatment. It's called Aqua-Gold. I don't know if you can see that. Aqua-Gold. And I'm not going to open this one because it's still sterile, so I'll just show you kind of in the box. But this is a little bitty vial. There's a bunch of knockoff ones, and oh God, don't look at my fingernails because I tried to do them myself. You guys, like, I should have my gloves on. I tried to do my nails. I totally appreciate nail technicians now. So this has got, I think it's 24 little gold needles in it, and then a little vial. And basically we make our own little cocktails in here for the patient, whatever it might be, but it typically has like Botox or Dysport in it, some filler in it, and then we'll choose either like vitamin C or B12 and put that in there, hyaluronic acid, and you can do peptides in there. You can also, I did the last one well, I didn't do the last one before we closed. We did some BioPel snail serum in there. And it goes just micro under the skin, so it doesn't pass into you know, past that subdermal whatever into your muscles. You have dermis. See, I'm not the medical one. I'm just addicted to this procedure. I'm the business person. But it is instant gratification. Your face is, because it's just right under the skin, so it kind of plumps up and it relaxes those little bitty fine wrinkles. And you're glowing, literally, don't you think, when you get it done? Like,
well, it's actually funny because I did it. I shaved my beard off to get it done, and people are noticing. They go, I don't know what it is, but the 7 weeks off did you well. Little do they know.
But do you look golden, or like?
It's, you get, I mean, we do numb because on your face. You can do your neck and hands, the back of your hands and stuff too, and you really don't need to numb, or even like the wrinkles on your knees you can do. But on your face, we do numb because it's a little bit more tender. So you get like a little red. If you use the B12, you do get that yellow, you smell like a vitamin and kind of thing, which is, I don't love, but I got itchy with a vitamin C, and a lot of people get itchy with vitamin C. So I do the B12, but and you don't want to wash it off because you really want that to kind of stay on your skin for at least a couple hours.
You just have to take the history of the patient, what they're
Yeah.
looking for, what they need, what they shouldn't have, allergies, stuff
Right,
like that.
right.
And it's really glow in a bottle.
It is, and it's customizable, and you can do it every month. Although it's very addicting, and like after you get it done, you're like, when can I get that done again? Because, and then you can wear makeup the next day. You can even wear makeup that night if you want to.
Just put on tinted moisturizer.
Yeah, every time I've had it done, I think 3 times now. Literally the next day, people are like, what did you do to your skin? It looks amazing. I was like, Aqua-Gold, Aqua-Gold. So,
funny thing is, gold is also an anti-inflammatory, and we use it in autoimmune disease like rheumatoid and other things. And it calms things down. So you've got the calming as well as the smoothing with the fillers and the micro relaxation. I don't think the Botox was going to be penetrating deep enough to really relax, but what it can do is relax some of the blood vessels in that area, which plumps up the skin and
right.
look much more full. And so how long do you find that the effect lasts for you? Like how many days?
You know, I think a good month, but from the research we've done on it, after about 3, so you can get it done every month, or you can do it every quarter. You know, it just depends on what kind of results you're looking for. I personally love the results so much that I don't think I'm going to skip a month. But it kind of builds on itself. So if you do it, 3 months in a row, you might notice, my results are lasting longer. Maybe I'll wait, 3 or 4 months or something. We have some people who have just, they've done, let's say, like 2 in 6 months kind of thing. And that's, they're not 51. They're 30 or something.
You look fabulous at 51. So
there's benefits to owning a med spa and having great friends like you, doctor. A lot of people refer to this as micro Botox. You'll hear people saying like micro Botox or micro filler, because it really is just the needles barely come out. And the other thing about them being gold is they don't get dull. So as you're doing like your face, your neck, your décolleté, your hands or whatever, they're not getting dull. You don't reuse it. It's a one-use cartridge.
How much is there? Like how many areas can you cover at one time?
It depends on how much product you're mixing into it. So, and you mix a little bit of saline into it as well, just so it's not super thick with the filler going in. So it's helpful for us to know beforehand how many areas we're doing so that we know how much to mix, but you can always just mix a little bit more in there. But as far as like how much, we normally use about a half of a syringe of a filler, 1 ml filler, 1 area of Botox, about that much, but you can do a little bit more, depending if you're gonna, this would just cover your face. So what the amount I'm saying right now would just cover your face. And then, whatever other things you want to put in there, whether it's the BioPel or hyaluronic acid or the B12 or whatever. So you basically are just mixing up as much as you think. If you're going to do the neck and here and back your hands or whatever, and then you're probably going to double, the amount of product.
Cool. That's a great tip. What about you, Veronica? What's your favorite product? Like what do you love to, if you could give one glamour tip, what would it be to people? Like if you could have any procedure you want or you recommend, what's your favorite?
I think my biggest thing is educating people. If you're going to do all of these procedures to your face and your body, is taking care of your skin and sunscreen, using good products and eating well, water. People just don't educate themselves, and I really take the time when I'm treating people to take that time to educate them and make sure that they're treating themselves good, not just spending all this money and effort on what we're doing here.
Yeah, that's really cool. Like our philosophy at Pulsar Health, and you're speaking to my heart here, is beauty built on health. And so it's not like gilding the lily, and like as Pamela said, the canvas has to be good quality. So yeah, the health stuff is good. But okay, suppose you've got a very healthy person. What procedure, if you could have anything to make them, give them a little va-voom, what would you recommend for va-voom? Because this is all about glam today.
I've never had anything. Botox right here to just give them a little lift. Opens up the eyes, makes them feel like they've had a little vacation. They're hooked, and you're your best client for them ever. They've never had filler, and never go filler on someone our age below the nose, because that just pulls everything down. Filler right through here, pulls everything up and fills through here. They're your best friend for life.
Yeah, yeah.
I would say that particular comment too, because we don't realize as we're aging, like our cheekbones and everything just disappear. Like you go, is it because I'm sleeping on my face? Like where did that side of my face go? So, you know, putting that in there really, you know, kind of gives you that definition. And it also kind of pulls this area up, you know, the nasal laser. I hate that name, but I just hate that name.
Then we finish it off with a magnificent hairstyle, and then if we need a more lift in the eyes, we pull back tight.
A nice ponytail. A nice ponytail that's nice and tight will just pull everything up for
A
you.
little secret, if we want to make like the hanging little bit of a thing in here, we keep the hair in the front,
Yeah,
like so.
or we wear scarves.
Shadow,
Or we wear scarves.
So like I said last time, you know, scarf, mask, and whatever else you can possibly do.
Oh, but seriously, your face shape can be made to look so different with a good haircut, the way it frames your face. Like, how do you pick what you want? Because often you go to a salon and you say, like, you can either say do whatever you want, or you say specifically what you want. And so, like, with the face shape and with age, do you change the style? Like, how do you go about, like, figuring out what you want to give a person? Like, how to give them that edge that people go, wow.
It's such a wonderful question, especially coming from someone like you who works on building their faces. So you understand proportion and all of those things. And even in our company, that's part of our job. I mean, we actually pay attention to the face shape and cut accordingly angles that complement, or maybe make the, you know, certain features look a little bit less if your face is too round, too diamond shaped, too this. Kind of like you are, but maybe a little bit different with our hair, obviously. But, you know, we always will look at the face shape and where the eyes are located in comparison to ears, nose, mouth, because not everybody's perfect. One thing I show people is I'll actually put the...
Anyone who's perfect, to be honest.
But I'll actually take the comb and put it right in front of people, and you can see that one eye is a little bit lower than the other, and I can actually change the appearance by actually changing the hair part sometimes. So if you got a low eye, I'll turn and part the hair on the other side when they think, and I go, wow, and they can't tell. All of a sudden it balances. So there's little secrets that we as hairdressers do, including cutting certain angles that create shadow, give you a little bit more of a jawline or whatever. And so it's a lot of fun what we can create too.
And a lot of times too, what people don't realize is they'll come in with pictures like, this is what I want my hair to look like. And it's a real challenge to be like, well, your hair is like not that texture, not that thickness. Like, we're gonna have to work around
to that point. A wonderful part of that, and I love that actually, because I know what they're thinking or what they see themselves. So it gives me a clearer indication of what they're thinking. I would imagine, doctor, you have the same issue. People are bringing in bodies that are just maybe not real in comparison, or you can get you to look better, but not that, you know. I actually tell you something really cute and funny.
Today, I actually texted somebody to ask them for a photo of some breasts they like. Because I know what they consider beautiful.
Don't ever ask him that question, okay?
different implants have different viscosities, like different different levels of stiffness, and so when you put them in, they're gonna sit differently. So I want to know what kind of round shape that they like, and like you said with the hairstyles, like what kind of thing are they really looking for? Because you can't give them exactly that, but you can give them that range, you know, that version of themselves. So
gives you a better idea of that.
Well, you know, the way they're thinking, and I will tell you, just so you know, a lot of them will ask the opinion of their hairdresser on what type of breasts they should have.
All right.
They do.
They'll even go, look what I just had done. Like, he comes home and tells me, I'm like, these are things I don't really want to know. I really don't want to know. Can we talk about breast a few more minutes though, since that is one of the things that you specialize in? I know we're kind of going.
Sure. A few more hair questions before Joseph.
Okay, more hair questions. We'll have a. I know, but there's a lot of people who have, like, I get all these questions all the time, you know, in confidence, like, well, I'm thinking about getting this done. And
well, maybe Joseph wants to hang around for the best breast questions. So why don't you ask the breast question and then we'll go back to hair.
Okay, so the breast question I get the most is, what size should I go, and should I go under the muscle or over the muscle? And I always say, if you're going under the muscle, it's going to appear smaller than if you're going over the muscle.
That's right. If you have enough breast tissue, I like to go over the muscle. That way you don't have like deformity from the muscle itself, and and it looks very pretty, and there's less pain, and so there's a lot of a quicker recovery. So there's a lot of benefits of going over the muscle. The problem with going over the muscle is the upper pole. Is like when you have like a more projectile breast, you can get a step off here if you don't have that muscle cushioning it, and you can get around it with fat injections, but that's another procedure then. Oh, so would it be better to do that, or would it be better to lift the muscle? And so that decision kind of depends also on how wide your chest is, and how much volume you want, how much projection you want, and how thick the implants are. So there's a lot of factors go into that, as well as what kind of look you want. As far as size goes, I like people to try on the sizers with a tight fitting shirt so that they can see the projections, and to go home with it and sort of try different sizes. I have like a sizing system.
He wanted to take some of those home. I was like,
they're very relaxing. When I had the girls, love playing with the implants. They're just like soothing. But anyway, I don't know whether that's from our childhood when we were babies.
Listen, this whole thing, we've been all over the place, and obviously breasts are not something that will make you, like, you can't get it done overnight and feel better, but it does.
Everybody happy.
It makes everybody happy.
I don't think I know a single person who isn't happy that they had their breast dog done. You know.
I agree. Let's see. How about one more treatment that is a.
Just want to say,
okay.
Because I always say negative.
Oh yeah, you had a hair question.
Say stuff. It's like the breast implant illness and the ACLS, the stuff you need to ask about your surgeon, because they can be negative consequences to implants. But
and that's something I would recommend people, because I think the thing is, a lot of times people don't know what questions they should be asking when it comes to that, and they're a little intimidated to ask. So
there's not enough education.
There's not enough education. So that's something I would encourage anybody who is considering doing that is a specialty of Dr. Gill's, and she will, I believe, really help you. Like, these are the questions you need to be thinking about, because not all doctors do that. They just kind of tell you what they want you to know instead of really try to educate you on.
Thank you.
So.
All right.
You had another hair question.
I was going to say my favorite thing for Va-voom.
Oh, no.
For not for breast surgery. Breast surgery is, but definitely Va-voom. But I like lip fillers for a lot of people. Not for me, not for Joseph, but not for any of us. But for most people, having a little bit of lip filler can really make you go, wow. Not too much. It has to be just enough to change the texture a little bit. But that can really change the appearance of the face and people's self-confidence. So that's one of my favorite procedures. Anyway, back to you.
Well, let me tell you what, to me it's really weird, but I tell so many people, and I don't know why it's become a thing with me, because obviously I see the face all the time, but I make a big deal of hands even. Like me, they actually have done a few treatments on my hands with, whatever, with microneedling, or even I've had injections with the PRP, and I have to tell you something, I don't know, it made a difference. I felt great, and I tell a lot of the women, of course, you take care of your face, your neck, that, but don't forget your hands, because you spend so much money on your nails, your hands really are out there, you're wearing beautiful jewelry, and I find that I was getting amazing, like the girls were practicing even on me and way back when, and I love having my hands look great. It's weird, but I like it. I think it looks cool, and I certainly love a woman who has beautiful hands. Just simply said,
I should put some gloves on.
Isn't it romantic when a guy takes your hand and kisses your hand? Isn't that like?
I know, you don't want him to take your hand and go, oh, what do you mean? I wanted to add on the lips thing, because a lot of people that I talk to, they are afraid they're going to get that like look, the duck lip look or something. And so I always tell people, like, I have 5 fillers in my face. I mean, I don't think I look like overdone.
Might win a point if you guess where.
Yeah, in my face. So and one syringe is in my lips. And I used to have great lips, but as you age, they just like shrink. Everything just shrinks. So they say one syringe for each decade of your life, and it's completely true. Like, you're not going to look overdone. It's replacing the bone loss that you have and the fat loss that you have, and especially if you smoke or I drink out of a straw all the time. A metal straw. I don't do the paper straw things, but and so you get like those wrinkles around your lips, and so we do a combination of Vivace, which is a RF microneedling, to treat that with a lip filler. Yeah, love Vivace. You have that too. I love that one.
Let me ask you a question. Is there a time, because I know like in my business, so with hair, I have to remember taking into consideration their lifestyle, the way they look in their face, the hairstyle. Obviously, I wouldn't do like Rod Stewart on a 90-year-old woman or anything like that. It doesn't make sense. Do you ever get to that place where and actually it would actually help me, where maybe go a little less, or, do you give advice that way? Is there a time to stop?
Oh, definitely. It is far, far harder to operate on somebody who's had too much done. I hate that. That's the worst. It's better to undercorrect than to overcorrect.
Sure.
And you want to adjust it with age, because the structures that support it, like your skin, your bone, they change with age. And so you want to have an appropriate volume for your age. But at the same time, like, I've known plastic surgeons who look much better now than they did 10 years ago, because they've been doing those micro adjustments to look really good. So having a proactive approach, you can actually look better and better over time, but you don't want to overdo anything. And so it's not a case of adjusting it because you're a certain age. It's a case of adjusting it depending on what kind of volume and projection would look best on your face, regardless of your age, and then how strong are those tissues to support the adjustment we want, and can we do anything to strengthen those tissues? Like the Vivace helps restructure the tissues. Certain treatments, like stem cell treatments, help strengthen the tissues. So how can we augment the support system? Because you've got your bone, you've got your soft tissue, your muscle, your fat, your skin, and each of those plays its part in how soft and mobile things are and how projectile things are. So it's not about, for me, it's not about age, it's about beauty and it's about health. And so I want people to look as fabulous as they can, and that look is going to change with age. For example, for me, my forehead used to be a lot lower. As over time, my hairline has risen, and that happens. But for me, it's a good thing because I had a chubby face. I still have a chubby face, but my hairline is better for my face. So it's not an age thing. It's just a thing. Well, this is the way it is now. And with breasts, they change. Like, for example, when ladies have smaller breasts, they're really happy in their 50s. But when they have bigger breasts, they're happy in their 20s, and then 50s.
Right.
A little help then. So
I know we're kind of running low on time, but I had 2 things I wanted to say on that. The first one is on the skincare part of things. There's a product that we carry that I'm super impressed with. It's not like an overnight kind of thing, but it's called Emipel, and it actually addresses the loss of estrogen in our skin. It doesn't cross the blood barrier, but it helps build those receptors in your skin for estrogen, so that you, as you're getting older and you're losing those, it actually builds from underneath to do that support like you're talking about. Technology. And the other question,
There's so much cool technology.
There is. It takes about 3 months before you really notice, but I sent some to my stepmom, who is probably close to 8. Anyway, she was like,
she's watching.
1 month, she is watching, but like 1 month into it, she's like, this stuff is amazing. Can you send me some more? So, you know, I think you do see a noticeable difference with that. And then the other thing I wanted to ask you, because it's a question we get a lot of, is, and I know like my mom has this problem, is that as you get older, everything starts kind of sagging, you know, and there's only so much you can really do with Botox to get like that lift. So my mom actually is having a hard time even with her vision because of the skin. So would you recommend like a bleph for that? Is that what that's called, where they take that skin? Or I also have known that there's some sort of like,
Yeah, I do.
something.
Yeah, I do a lot of, I specialize in craniofacial. I love breasts, but my craniofacial is like my very, very favorite. And there's
Are you going to send me some pictures of the type of breast that you like? No, I'm just playing. Go ahead.
What you want is, so there's 2 or 3 things. If your eyelids are interfering with your vision, most insurance will cover for you to have a blepharoplasty. So
Okay.
you might be able to get it paid for.
She's like, well, she's on Medicare, you know, like she's older.
Right, yeah, but if your upper eyelid skin is touching your eyelashes, that's kind of the criteria for an insurance.
Okay.
Now,
Okay.
if it's not quite that bad, you can have a bleph, but you want to see, why is it drooping? Is it because the forehead muscle, or is it because everything's sinking? Like, what's causing it? Is it just too much loose skin here? Now, if it's a case that your brows are dropping, having like a few threads put in there can really help. You want to see like how the threads. I love the threads. I actually teach other doctors how to put threads in. So
yeah, we don't do them here, but it would be nice for you know, just because we haven't. But
yeah, I could come over and I could teach Veronica, so I could show you guys. You can have threads put in that give you a brow lift. You just want to make sure, with like a lot of the brow lifts, they tended to raise the hairline too much, and so you want to be careful that your hairline, the height of your forehead is appropriate for your face shape and what you want to look like. And so, as Joseph knows, that's really important, and you don't want to cover everything with bangs, but so you have to decide like exactly how much forehead you want, because you can raise your forehead either with a coronal lift or with a hairline lift, or you can do a direct brow lift. You can do blepharoplasty. There's a lot of different things you can do. One of the most non-invasive is to do the little Botox to lift it here, but you also can do the threads. And I love the threads because they're you don't go to sleep for them. They are a little uncomfortable, but they work really well for a few months to even up to a year. So look into.
Okay, I will. Well, she'll be watching this also, so she's been asking me, and I'm like, you know, Mom, don't mess with your eyes, but
called a plasma pen that people have been using for their
yeah, we were looking at that actually.
The plasma pen is okay. It gives you you can do it more than once, but you need to leave it 3 months between. It gives you a little bit of superficial scarring. The scabs have to fall off. I don't get it because I don't think it gives me enough of what I want to get. But if
for the downtime involved, like there's a good amount of downtime
for a week or so. But if you definitely don't want surgery, or you don't want to try other things, like even the Vivace can tighten it up a bit. So when we do Vivace, we pull that area into the needling area. So how much you need, and the plasma pen may or may not help you. I haven't got that yet because I like the Vivace and I like the knife. So
and are those? I like the knife. Give me the scalpel.
And I like the scissors.
And we actually, with this whole COVID thing, we instituted the ability to do like telemed consultations. So those are types of things that we can do, you know, both the MediSpa can do, not with the plastic surgery stuff, but, you know, to do the consultation before somebody comes in if they need that. Or if you have somebody who's out of town or can't make it in, you can do the consultations for that type of thing over telemed.
And I actually did a consult on Sunday with a pair with a girl I know who came in before, but she lives on the other side of Florida. So we did a telemed consult for skincare. The only problem I had with it was the lighting. She had a ring light, but it wasn't quite good enough to see every detail that I like to see. So you might want an outdoor natural light or some other, or be by a window when you want to do these consults, but they are so good because otherwise you're just going blind. But with having a telemed consult, whether it's for your skincare, whether it's for your immune health, whether for whatever it is, it really gives you another option to get another opinion, if nothing else.
Right, and you don't feel that pressure like, oh, I'm going to go in and it's going to be some hard sell situation. You know, you just can figure out if it seems like a good fit for you and what.
you get more information, which is
Yeah.
that's tailored for you. So and
Right.
that's what is really helpful. So.
So, and do you have a link on your, I know on our website, we have a link to request a telemed a consultation. Do you have that on your website as well?
Yeah, there is. Yeah.
Okay. So,
But I want Joseph's opinion, so I'm gonna have to come to Boca to get my hair done.
Absolutely. But I want to speak to quickly what you were talking about, like telemedicine, because we've had a few people who were asking me questions on how to help them, and they were doing things with their hairdresser. Not people who work with me, but they were doing either Skype, Zoom, or whatever. Now, just like you said, lighting, so it might appear red or brown or whatever. So I strongly advise, don't do that.
Yeah.
You must see them in person. It does not work because for hair, when you go, not for skin of course, but when you go out into natural light, oh my God, what a difference. So strong recommendation, don't do it. But
Yeah. Great.
quickly, I have to say I'm really pleased and grateful that I've been invited to work with you guys on this, because I think all of us love what we do. We make people beautiful. I'm excited to go back out there right now and work and lift people's spirits. I got to tell you, people go, you have no idea how much I needed all of this. You know, they really, I think this is the one part that what we all do changes their life. And we might have saved a couple between all of us. So thank you.
No, thank you, and thanks for bringing the joy and like the joie de vivre of life to whatever you do, Joseph. I really appreciate
Thank you. I'm having fun.
Yeah, I love it.
oh, I'm sorry. Because I just for tomorrow we're doing cupping. So Cupping USA, Cupping Canada will be on and talking with us. That's Wellness Wednesdays about the benefits of cupping.
If you need a model, I want to do it.
Well, we're doing it all here, so I'm gonna go get a cup and just stick it on your head.
Thank you.
So I'm really interested to learn about that because I don't know much about cupping. So yeah.
Awesome. Great. Well, we'll see everybody tomorrow. Okay, thanks.
Okay. Bye. Thanks, Dr. Gill. Okay, bye. Oh, how do I get out of here?